So today's lecture focuses on cognition and aging, and I'll just cover some highlights from some studies. And one of the biggest changes in cognition is memory. So we see age-related differences in several forms of memory. This data comes from a large cross-sectional study. And you can see that in general, working memory, short-term memory, long-term memory, and speed of processing all get worse. The one exception seems to be verbal knowledge, which stays stable or by some measures actually increases. This is another study looking at variations in memory. So this graph looks at comparisons between recollection versus familiarity. So recollection is retrieving contextual information from past events, and we see that recollection is substantially impaired with normal aging. In contrast, though, familiarity is feelings of recognition or oldness about the event in the absence of any kind of retrieval or contextual information. And familiarity is unimpaired with normal aging. So to test differences, what they'll do is they'll give people a study list of words or phrases and ask to classify whether they remember them or whether they know them. And what they find is that increasing the interval between studying and testing decreases how well people remember responses, but does not affect how well they know them. So what you can see here, when we compare young versus old, is young participants were more likely to remember specific words, but old participants were more likely to say that they knew words or were familiar with them. So we see the decrease in recollection, but an increase in familiarity. In terms of short versus long-term memory, we see long-term forgetting with new information that interferes with previously learned information. So the more information people have as they get older, the worse their long-term memory is. Short-term memory has to do with the capacity we have to hold information for a short period of time. We see little to no effects of aging. In terms of working memory, we're talking about simultaneous processing and storing of information. And older adults do more poorly on working memory. Young adults seem to be much faster at scanning the contents of memory. Another important distinction when we look at memory is explicit versus implicit memory. So explicit memory is memory for events in kind of the distant past, or memory for more recent events, but they're things that you can consciously remember. So explicit memory for distant past holds up well with age. Explicit for newly acquired memory, explicit memory for newly acquired information decreases with age. Implicit memory, in contrast, is sometimes called non-declarative memory. So these are things that you don't necessarily consciously remember. Things like how to hold an object or physical motion or how to ride a bike, things like that. And implicit memory does not seem to be affected by age. So we see these kind of general declines in speed and efficiency of processing information, but it doesn't necessarily affect the knowledge that is already stored for older adults. In terms of changes in intelligence scores, so this is looking at age-related changes on the Wechsler scales on the verbal IQ versus performance IQ. And this is cross-sectional, so it's not following the same people over time. It's just looking at people in each of these age brackets. I can get my mouse to come up here, which I can't. Intelligence, what you can see is, we see kind of a general pattern of steady decline and kind of irreversible decrement. But especially for performance IQ, it gets much worse with age. With verbal IQ, though, just like with verbal memory, we see this kind of increase in mid to older adulthood, and it doesn't start declining until you get past middle adulthood. Okay. However, an important thing to remember, though, is although we see overall declines, early intelligence predicts cognitive performance in older age. So people who do more poorly at age 11 do more poorly at age 80. Likewise, those who do very well on intelligence tests at age 11 continue to be the ones who do very well at age 80. Another kind of phenomenon that we see is that older adults tend to be more affected by emotion in their decision-making and problem-solving. So this graph compares deliberative processing versus affective processing. So deliberative processing is an individual controlled kind of cognitive function like working memory or executive function. You are making a conscious and logical decision-making process, and what you can see is that deliberative processing decreases with age. And this is kind of an average of several studies. Some, although not all, but many studies show that we do see age-related gains in affective processing. So this is processing of information that has some kind of emotional significance. So for example, when people are asked to remember images, older adults have a higher ratio of positive to negative memories. So they seem to have kind of a bias in terms of remembering the positive, but they actually remember the positive better than younger adults. Okay, so in terms of reducing the risk of intellectual decline, you have an article, a reading on this, but some other things that are associated with less intellectual decline, the absence of cardiovascular or chronic diseases helps, and things like favorable environment and high socioeconomic status can help improve that. Constant intellectual stimulation. Good stimulating environments are really important to prevent intellectual decline. So sitting around doing nothing is not productive, and it leads to faster rates of intellectual decline than older adults who are constantly working and thinking and challenging themselves. People who are more flexible also have less cognitive decline. And then social contacts. So spouses or other close social contacts who have higher IQs and higher cognitive status tend to lead to less intellectual decline. So possibly those social contacts that are smart are providing you with a cognitively challenging situation that prevents this decline. So one of the kind of classic examples of cognitive decline, or the worst case scenario, is dementia. And this is acquired and persistent syndrome of intellectual impairment. It's characterized by memory and other cognitive deficits, and also impairment in kind of functioning. So social, occupational functioning, kind of we see impairments throughout life. So it's important to kind of note that Alzheimer's disease is one of several types of dementia. So dementia is kind of general cognitive decline and impairment. Alzheimer's accounts for most dementia cases, but by no means all. We don't have specific causes, but there's a couple of proposed causes, and we know that generally there's a pattern of clear neural degeneration. So things like genetics can influence it, environmental toxins, some kind of autoimmune response or a virus, and reduced blood flow to the hemisphere have all been proposed as explanations for Alzheimer's. And we actually can't officially diagnose Alzheimer's until after death. But when we do, the way we diagnose it is through an autopsy, and the biggest kind of hint that someone has suffered from Alzheimer's after death is cortical degeneration. So we see that a healthy brain looks full and plump, whereas a brain with Alzheimer's, you can see there are a lot of gaps, and it's just generally degenerated. It's not as full, and there's not as much kind of neural communication going on. The most affected areas of brains with Alzheimer's are the limbic cortex, the inferior temporal cortex, and the posterior parietal cortex, which all are associated with memory loss. The primary sensory and motor areas are spared, which is why people with Alzheimer's have no problem talking or movement, or rarely have problems with talking or movement, but we see these huge cognitive deficits. That helps to explain. So you've also got a video that gives you a little more information on Alzheimer's, and also some articles on cognitive degeneration. So